Psychological disorders. Psychological disorders are also known as mental disorders or mental illnesses. They refer to a wide range of conditions that affect a person's thoughts, emotions, behavior, and overall mental well-being. These disorders are characterized by significant disturbances in cognition, emotion regulation, and behavior that cause distress or impair functioning in various areas of life. Psychological disorders can vary in terms of their symptoms, severity, and impact on individuals. They can affect people of all ages, genders, and backgrounds. Here are some common types of psychological disorders. 1. Anxiety disorders. These include conditions such as generalized anxiety disorder, panic disorder, phobias, and obsessive-compulsive disorder. They are characterized by excessive and persistent fear or worry that significantly impairs daily functioning. 2. Mood disorders. Examples include major depressive disorder, depression, and bipolar disorder. These disorders involve disturbances in mood, ranging from persistent feelings of sadness and hopelessness, depression, to alternating periods of mania and depression, bipolar disorder. 3. Schizophrenia spectrum disorders. Schizophrenia is a chronic disorder that affects a person's perception, thinking, emotions, and behavior. It may involve hallucinations, delusions, disorganized thinking, and social withdrawal. 4. Personality disorders. These disorders involve enduring patterns of behavior, cognition, and inner experience that deviate from cultural expectations. Examples include borderline personality disorder, antisocial personality disorder, and narcissistic personality disorder. 5. Eating disorders. Conditions like anorexia nervosa, bulimia nervosa, and binge eating disorder are characterized by abnormal eating behaviors, distorted body image, and extreme preoccupations with weight and shape. 6. Substance use disorders. These disorders involve the excessive use or dependence on drugs or alcohol, leading to significant impairment in functioning and negative consequences. 7. Neurodevelopmental disorders. This category includes conditions that manifest early in development and impact cognitive, social, and behavioral functioning. Examples include attention deficit/hyperactivity disorder, ADHD, autism spectrum disorder, ASD, and intellectual disability. 8. Sleep disorders. Sleep-related conditions, such as insomnia, sleep apnea, and narcolepsy, involve disturbances in the quality, timing, or duration of sleep, leading to significant distress or impairment. It's important to note that psychological disorders are complex and multifaceted. They can arise from a combination of genetic, biological, environmental, and psychological factors. Diagnosis and treatment of these disorders often involve a combination of therapy, medication, lifestyle changes, and support from healthcare professionals. Scientists have long recognized that many psychiatric disorders tend to run in families, suggesting potential genetic roots. What are they? There is evidence suggesting a genetic component in the development of psychiatric disorders, while the precise genetic causes of these disorders are still being studied. Researchers have identified several mental illnesses that tend to have familial patterns. Here are some examples. 1. Schizophrenia. Family, twin, and adoption studies have consistently shown that schizophrenia has a significant genetic component. Individuals who have a first-degree relative, parent, sibling, or child with schizophrenia have a higher risk of developing the disorder compared to the general population. 2. Bipolar disorder. Family and twin studies have demonstrated that bipolar disorder has a strong genetic basis. People with a family history of bipolar disorder are at an increased risk of developing the condition themselves. 3. Major depressive disorder. Studies indicate that major depressive disorder has a hereditary component. Individuals with a family history of depression are more likely to experience depression themselves. 4. Autism spectrum disorder, ASD. Research suggests that genetic factors play a role in the development of ASD. Studies of twins and families have shown a higher concordance rate among identical twins compared to fraternal twins, indicating a genetic influence. 5. Attention deficit/hyperactivity disorder, ADHD. ADHD has been found to have a genetic component. Family, twin, and adoption studies have consistently shown that ADHD tends to run in families. 6. Obsessive-compulsive disorder, OCD. There is evidence suggesting a genetic predisposition to OCD. Studies have found that individuals with a family history of OCD are at an increased risk of developing the disorder. 7. Anxiety disorders. Genetic factors are believed to contribute to the development of various anxiety disorders, including generalized anxiety disorder, panic disorder, and social anxiety disorder. It's important to note that genetics is not the sole determinant of these disorders. Environmental factors, such as stress, trauma, and life experiences, also play a significant role. The interplay between genetic predisposition and environmental influences is complex and still under investigation. Further research is needed to fully understand the specific genes and mechanisms involved in the development of these psychiatric disorders. Are there other causes to psychological disorders? In addition to genetic factors, psychological disorders can also be influenced by various other causes. It's important to recognize that mental illnesses are typically the result of a combination of multiple factors, and the specific causes can vary depending on the disorder and the individual. Here are some additional factors that can contribute to the development of psychological disorders. Environmental factors, adverse life experiences, such as trauma, abuse, neglect, or significant stressors, can increase the risk of developing mental disorders. These experiences can have long-lasting effects on an individual's mental well-being. 1. Biological factors. Apart from genetic factors, certain biological factors can contribute to mental illnesses. Imbalances in brain chemistry, structural abnormalities in the brain, hormonal imbalances, and changes in neurotransmitter functioning can all play a role in the development of psychological disorders. 2. Psychological factors. Psychological processes and individual characteristics can contribute to the development of mental disorders. This includes factors such as personality traits, coping styles, cognitive biases, and negative thought patterns. For example, individuals with low self-esteem or a tendency to ruminate may be more susceptible to depression. 3. Developmental factors. The early developmental period is critical for mental health. Factors such as prenatal exposure to toxins, complications during birth, early childhood trauma, and disruptions in attachment can have long-term effects on psychological well-being and increase the risk of developing mental disorders later in life. 4. Substance abuse. Substance abuse can lead to or exacerbate mental health issues. Drug and alcohol abuse can alter brain chemistry and contribute to the development of psychiatric disorders, including substance use disorders, depression, and anxiety. 5. Social and cultural factors. Social and cultural factors, such as social isolation, discrimination, poverty, lack of social support, and cultural expectations, can impact mental health. These factors can influence the development, expression, and treatment-seeking behaviors related to psychological disorders. It's important to note that the causes of mental disorders are often complex and interconnected. The interaction between genetic, environmental, biological, and psychological factors is dynamic and varies from person to person. Understanding these multifaceted causes is crucial for effective diagnosis, treatment, and support for individuals with psychological disorders. What are the signs and symptoms of psychological disorders? Signs and symptoms of psychological disorders can vary depending on the specific disorder and the individual experiencing them. It's important to note that the presence of certain symptoms does not necessarily indicate a particular disorder, as many symptoms can overlap across different conditions. A proper diagnosis should be made by a qualified healthcare professional. However, here are some general signs and symptoms that may indicate the presence of a psychological disorder. 1. Changes in mood. Persistent feelings of sadness, hopelessness, irritability, anxiety, or excessive worry can be indicative of various disorders, including depression, anxiety disorders, bipolar disorder, or post-traumatic stress disorder, PTSD. 2. Changes in behavior. Noticeable changes in behavior patterns can be a sign of a psychological disorder. This may include social withdrawal, increased agitation or restlessness, changes in sleep patterns, insomnia or excessive sleep. Appetite and weight changes, self-harm, or engaging in risky behaviors. 3. Distorted thinking patterns. Psychological disorders can involve cognitive distortions and abnormal thought patterns. These may include persistent negative thoughts, excessive self-criticism, difficulty concentrating or making decisions, irrational beliefs or fears, or disorganized thinking. 4. Emotional instability. Rapid or extreme shifts in emotions, frequent mood swings, or difficulty regulating emotions can be seen in conditions such as borderline personality disorder, bipolar disorder, or certain types of anxiety disorders. 5. Disturbances in perception. Disorders such as schizophrenia may involve perceptual disturbances, including hallucinations, seeing, hearing, or sensing things that others don't. Delusions, firmly held false beliefs, or disorganized speech and behavior. 6. Impairment in functioning. Psychological disorders can significantly impact a person's ability to carry out daily activities, maintain relationships, and perform at work or school. This may manifest as a decline in academic or occupational performance, difficulty maintaining personal hygiene, social isolation, or strained interpersonal relationships. 7. Changes in energy levels. Fatigue, lack of motivation, or a significant decrease or increase in energy levels can be signs of various mental disorders, including depression, bipolar disorder, or certain anxiety disorders. 8. Substance abuse. Increased or compulsive use of substances such as drugs or alcohol can be a sign of a co-occurring mental health disorder, such as a substance use disorder or a dual diagnosis. It's important to remember that these signs and symptoms can vary in intensity and duration. If you or someone you know is experiencing persistent or concerning symptoms, it's crucial to seek professional help for an accurate diagnosis and appropriate treatment. When does a mental health concern become a psychiatric disorder? Determining when a mental health concern becomes a psychiatric disorder is not always a straightforward process. The transition from a general concern to a diagnosed psychiatric disorder typically involves several factors and requires the expertise of a qualified healthcare professional. Here are some key considerations. 1. Duration and persistence. Mental health concerns that persist over time and significantly impact daily functioning may indicate a psychiatric disorder. For a diagnosis, symptoms typically need to be present for a specific duration specified in diagnostic criteria, example, 2 weeks for major depressive disorder. 2. Intensity and severity. The intensity and severity of symptoms play a crucial role in diagnosing a psychiatric disorder. Symptoms that are severe, distressing, or impairing functioning may indicate the presence of a mental illness. 3. Impairment and distress. Psychiatric disorders are characterized by the impairment they cause in various areas of life, such as work, school, relationships, and self-care. If symptoms significantly interfere with one's ability to function and lead to distress, it may suggest the presence of a psychiatric disorder. 4. Diagnostic criteria. Psychiatric disorders are typically diagnosed based on established diagnostic criteria outlined in diagnostic manuals such as the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, or the International Classification of Diseases, ICD-11. Healthcare professionals use these criteria to assess whether an individual's symptoms meet the specific criteria for a particular disorder. 5. Evaluation by a healthcare professional. To receive a formal diagnosis, it is necessary to consult with a qualified healthcare professional, such as a psychiatrist, psychologist, or clinical social worker. They will conduct a comprehensive assessment, considering various factors like symptoms, duration, impairment, and medical history, to determine if a psychiatric disorder is present. It's important to note that the diagnosis of a psychiatric disorder is not a definitive label but rather a tool to guide treatment and support. Mental health exists on a continuum, and individuals may experience varying degrees of distress or impairment even without meeting the criteria for a specific disorder. Seeking professional help is crucial if you or someone you know is experiencing mental health concerns to receive an accurate diagnosis and appropriate treatment. How psychological disorders are diagnosed. Psychological disorders are diagnosed through a comprehensive assessment conducted by qualified healthcare professionals, such as psychiatrists, psychologists, or clinical social workers. The diagnostic process involves gathering information about an individual's symptoms, medical history, psychological functioning, and any relevant contextual factors. Here are the key steps typically involved in the diagnosis of psychological disorders. 1. Initial evaluation. The healthcare professional begins by conducting an initial evaluation to gather information about the individual's concerns, symptoms, and overall mental health. This may involve a structured interview, self-report questionnaires, and discussions about the person's personal and family history. 2. Diagnostic criteria. The healthcare professional refers to established diagnostic criteria outlined in diagnostic manuals, such as the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, or the International Classification of Diseases, ICD-11. They compare the individual's symptoms and experiences to the specific criteria for various disorders to determine if they meet the diagnostic criteria for a particular condition. 3. Differential diagnosis. In some cases, multiple disorders may share similar symptoms. The healthcare professional considers different possible diagnoses and conducts a differential diagnosis, which involves systematically ruling out other potential explanations and narrowing down the most accurate diagnosis. 4. Clinical interviews and observations. The healthcare professional may conduct clinical interviews to further assess the individual's symptoms, emotional state, thought processes, and behaviors. They observe the individual's appearance, behavior, and speech patterns to gain additional insights. 5. Collaboration with other professionals. In certain cases, collaboration with other professionals, such as primary care physicians or specialists, may be necessary to rule out any underlying medical conditions that could be contributing to the symptoms. 6. Assessment tools. The healthcare professional may use standardized assessment tools, such as psychological tests, self-report questionnaires, or rating scales, to gather additional information and assess the severity of symptoms. 7. Cultural considerations. Healthcare professionals take into account the cultural context of the individual, as cultural factors can influence the expression and interpretation of symptoms. They consider cultural norms, beliefs, and values when making a diagnosis. 8. Formulation and diagnosis. Based on the information gathered, the healthcare professional develops a clinical formulation, which is a comprehensive understanding of the individual's symptoms, functioning, and potential underlying causes. They then provide a diagnosis, identifying the specific psychological disorders that best fit the individual's symptoms and experiences. It's important to remember that the diagnosis of a psychological disorder is not a definitive label but rather a tool to guide treatment and support. A proper diagnosis helps in developing an appropriate treatment plan and determining the most effective interventions for an individual's specific needs.